5 years ago, I had the pleasure of presenting at the plenary session the initial data with this drug ipilimumab, the first drug in metastatic melanoma, an immune checkpoint inhibitor to actually cause long-term survival in about 1 in 4 melanoma patients. What we've heard today is in 5 years, another checkpoint has been identified called PD-1, and several drugs have been identified against that target. And then, so what you heard today was a large randomized study, 900 patients, global study in metastatic melanoma, comparing ipilimumab by itself, the nivolumab, the PD-1 drug by itself, or the combination of the two. And the take-home message is both the PD-1 drug by itself, nivolumab, and the combination did much better than ipilimumab.
What's your take on this finding?
Well, it's very encouraging. And a second finding really is that the combination did better than the PD-1 by itself, substantially so in terms of progression-free survival. Now, it came with an added cost with the combination, but there may be a marker now called PD-L1, which may be able to identify which patients truly need the combination or which can get away with the PD-1 drug by itself, which would be hugely helpful.
So what's your brief message about what clinicians should make of this right now?
Well, that immunotherapy is front and center in melanoma at first treatment, and PD-1 drugs are there, and combinations need to be carefully considered based on the data from today showing that they may even be better, but a careful discussion with side effects and clinical benefit need to have it take place between the patient and the doctor.
And how clear is the information from PD-L1 expression?
Well, it was remarkably good in this study, not at identifying who gets treatment at all, but who would probably benefit from the combination or who needs that versus who can get away with the PD-1 by itself.
Quick bottom line on where this is all going?
We are in a brave new world of immuno-oncology and melanoma, and we are now probably producing long-term survival in more than half of patients who have widespread disease. Even more exciting is that these therapies are translating across the board in cancer, and I think you have a sense here that the momentum is just palpable in cancer from these drugs.